Thanks everyone for joining us. It takes Zoom just a minute to add everybody into the room, so please sit tight and we'll get started in just a few moments. Thanks. Thanks everyone for joining us. Just takes Zoom about a minute to let everybody into the room. So sit tight and we'll get started in just about 30 seconds. Thanks so much. Okay, hopefully now Zoom has had time to add everybody into the room. So we will go ahead and get started. Thank you everyone for joining us. Welcome to the latest Duke media briefing on the COVID-19 pandemic and its effects on society. I'm Gregory Phillips with Duke Communications and I'll be moderating this event. Despite persistent calls to wear a mask in public and socially distance, many Americans are not following public health recommendations. And for some, that reluctance also extends to vaccines. We have three Duke scholars with us today to discuss what causes resistance to public health messages and what kind of tactics can help address people's reluctance to adhere to guidelines that could shorten the pandemic. I'll introduce our speakers and get the discussion started, then we'll open it up to questions. We are recording this briefing and that recording will be sent to everyone who registered. Thanks to those reporters who already sent questions. During this discussion, those of you joining us on Zoom can submit questions via the Q&A window at any time. There will also be an opportunity to ask questions in person in a few minutes. Thanks also to everyone watching this on YouTube. With us today is Lavanya Vasudevan. She is an assistant professor in the Department of Family Medicine and Community Health and the Global Health Institute at Duke. She is also a faculty affiliate at Duke's Center for Health Policy and Inequalities Research. Good morning to you.
Good morning, Greg.
And we have Gavan Fitzsimons. He is a professor of marketing and psychology at Duke's Fuqua School of Business, where he studies how consumers can be unintentionally and unconsciously influenced, including how they respond to various messages. Good morning, Gavan.
Good morning, Greg.
Thanks. And Gary Bennett was also listed on the advisory as a panelist, but was unable to join us this morning. Fortunately, we have Benjamin Anderson with us. He is an assistant professor of science and global health at Duke Kunshan University in China, where he studies emerging infectious diseases, zoonotic diseases, and viral respiratory pathogens. Good morning to you.
Good morning, Greg.
Okay, so we'll jump right in here. Professor Fitzsimons, I'd like to start with you. What's the psychological basis for some of the pushback against mask wearing, and how can public messaging begin to break through that?
So for many years, we've been studying resistance to persuasion appeals, and there's a psychological phenomenon known as reactance, which basically is a motivational state which kicks in when someone tries to take away a decision freedom. So if I have a freedom to do something, I perceive that I have a freedom to do something. I'll give you an example. Perhaps I feel that I have the freedom to drink fresh water. If you take away my freedom to drink fresh water, a motivational state kicks in called reactance, and that motivational state directs me to do everything in my power to restore my freedom to drink fresh water. This sort of underlying psychological response to a threat to a freedom is quite powerful. Some people respond to it more strongly than others. About a third of the population has what we would characterize as an extremely strong reactant response when a freedom is threatened. And people will go to great lengths to try to restore their freedom. In the context of the pandemic, many people perceive that some of the public health guidelines are direct threats to their freedoms. And as a result, this motivational state kicks in where they'll go to great lengths to not follow those guidelines. And as a result, we see non-compliance with the recommendations. And so much of what we've done in other contexts and have been doing over the last couple of months in the context of the pandemic is to try to motivate people that have this strong backlash response to try to let them feel that they have the freedom to make a choice. And when the freedom is theirs to make the choice, they tend not to bristle and backlash nearly as much. And we also have been working to try to provide a motivation for why they would want to override their basic backlash response. And so, simple things like, if you would like to keep this restaurant open, then please choose which of these 3 types of face coverings would be best for you. So I'm motivated to keep my favorite restaurant open, and I have a choice of which face covering to wear. And that tends to be pretty effective at reducing this natural tendency to fight to restore the freedom that people perceive has been taken away from them.
Absolutely, thank you. Certainly lots to dig into there, and we'll come back to that. But Professor Anderson, I'd like to move on to you. Based on your experiences in China, you work at Kunshan, which is close to the epicenter, and obviously in Asia there is more of a mask-wearing culture to ward off illness. But there's also big cultural differences between China and the US. Are there any lessons about promoting public health that you think can span the cultural divide and also be effective here?
Yeah, so I think one of the primary takeaways in both being in China and then now coming back, being in the US and seeing the response play out in both countries, one of the things that has been very clear as a stark difference from the public health response has been the communication. And in China, there's a very centralized approach, of course, with the government structure, but they really turned over the response efforts to their public health system. And they have a pretty robust public health system that operates throughout the country. And one of the things that was very clear was there was a very consistent message that was shared in China in terms of how the response was going to be rolled out, what measures would be put in place, and the expectations of the citizens to follow through on some of those orders that were put into place for the response. Coming back to the US and seeing how the public health response plays out here, where the leadership on the national level gave more deference to the states. And so even though we know that that's probably a good thing in terms of implementation, each state has a different context, it also affected the messaging. And what we're seeing is a lot of different messaging that's going out across different states, which is really creating a lot of confusion as people are seeing different things presented to the communities in terms of what's effective, what's not effective, states taking on different positions on what they would implement in terms of stringencies and measures. And so I think with that inconsistency, that's created an awful lot of confusion, which has opened the door for more political discourse to kind of take over, which is causing people to not trust the messaging that's coming out. And I think as we look at the research, the data shows very clearly that trust is a very important component. Trusting government and trusting government structures is an important component for people to adhere to the measures that are being recommended. And without that trust, it makes it very difficult for adherence to be high.
Absolutely, and certainly there's more to discuss there. And before we move on to that, I'd like to move on to you, Professor Vasudevan. One of the crucial elements of beating this pandemic, we're told, is that once a vaccine is available, it needs to be everybody needs to be vaccinated. But how concerned are you that there could be resistance to a COVID vaccine once it's available? And what do you think can be done to address that resistance?
Yeah, thanks for that question, Greg. I want to start by saying that a vaccine is our best shot for ending this COVID-19 pandemic. As someone who works on vaccine hesitancy for a living, I'm very concerned about resistance to a COVID-19 vaccine once it's available. And I say this for 3 reasons. First, we actually have data about vaccine resistance related to COVID. So we have polls out there which say anywhere between 30 to 50% of the population has concerns about the vaccine. And we know from our research that unvaccinated individuals cluster in communities. So there may be communities where vaccine acceptance may be very, very low. And we need more research to uncover reasons for this and identify what the proportion of the population that's resistant. I think the second point is that we are having trouble convincing people to adopt very simple behaviors. So wearing masks, physical distancing, washing hands. And so I'm concerned that it may be harder to convince people to adopt more difficult behaviors such as vaccines. And the third point I want to make is that resistance to vaccine is not a new phenomenon. So even leading up to the COVID-19 pandemic, we saw some of the worst measles outbreaks that we've had in a while, including in the US. And we've continued to hear anti-vaccine rhetoric and anti-vaccine sentiments throughout the pandemic, as you mentioned in your opening statements. And so all these reasons make me really concerned about vaccine resistance. I think the best strategy we have to combat vaccine resistance at this point is to invest in communication, communicating early, communicating often, communicating through trusted entities, and really focusing on our confidence in vaccines and relaying the importance of vaccine, I think is critical. And because as I mentioned earlier, vaccines are our best shot for ending this pandemic.
Gotcha. Thank you, Professor Vasudevan, and thanks to all three of our panelists for those comprehensive opening answers. We can now open this up to questions. As I mentioned earlier, you can ask a question in the Q&A window if you like, and you can also raise your hand in Zoom so we can unmute you and you can ask a question directly. For those of you joining us by phone, you can hit *9, which will raise your hand and we can unmute you. Okay. So we've got a question for Professor Fitzsimons regarding you mentioned about offering choices to people, and this is a way to empower people to feel like their freedom's not been taken away. The question here is it not also the responsibility of a business to deny service for, say, an uncovered face, much in the same way that they might have a no shirt, no shoes policy?
Yeah, I mean, my understanding, not being a lawyer, but my understanding of many of the locally accepted ordinances place the legal burden on the retailer to actually enforce face covering guidelines. So it is up to the retailer there. Now, you know, there are ways to enforce that will lead to resistance, and there are ways to enforce that could minimize that resistance. And so, you know, for example, again, if you want to minimize resistance, we want to try to give some agency to that shopper, for example. And so, you know, rather than approach and say, ma'am, you must wear a face mask, you could approach and say, ma'am, the local law suggests that we have to wear face masks. We have 3 different types, each of which are quite comfortable. Which of these might you like to use today? And that you know, it's not perfect, but it helps. You know, we found it over and over again when you threaten a freedom. If the person whose freedom is threatened feels that they're part of the solution, they have agency in some way, they're much more likely to comply. And so, again, just giving them some form of choice helps a lot.
Gotcha. Yeah, that makes a lot of sense. Professor Anderson, we've had a question in the Q&A that I'd like to pose to you. So here in North Carolina, several weeks ago, the governor put in a mask wearing mandate for all public spaces. And we've seen that in a lot of states around the country. When you have a situation in which not a lot of people are wearing masks, a mandate comes in and mask wearing increases, how large is the window before you would expect to see some kind of measurable impact from that? In terms of maybe like a lower growth in cases, is that mandate the kind of thing that it will take to restore public trust, having a mandate and then seeing results from it?
Well, it's a great question, and there has been a couple of studies that have looked at comparing cities that have implemented mandates throughout the country compared to those who have not, and there have been quantitative numbers showing that a reduction in cases has occurred as early as 5 days after the mandate has been implemented. Now, there's a lot of other variables that have to be assessed to see whether, you know, that effect is fully from the mandate or not. But the general consensus of those studies is that the mandates are effective in reducing once they're implemented and they're adhered to in a reasonable way. In terms of the trust, that's a little bit more complicated, particularly as the pandemic wears on and people are getting information from different sources now, and they have different perspectives on how they view certain guidelines, or they view certain sources. I think what we're going to see is a lot more studies and kind of understanding where data sourcing is occurring and where people are actually getting their information. I think at this point, probably a lot of people have kind of locked into certain sources, and if they feel like they have a mistrust of a particular source, whether that be a government official or others, it might be very difficult to restore trust in that source to be able to have consistent messaging at that point. The idea is being that the damage has already been done. So I think the mandates, as they roll them out, it's really important to practice good communication. Has been recommended before. Consistency is important, but frequency is also very important. And having a transparency in those decision making, those always tie back to having greater adherence in the communities anytime you're rolling out public health measures.
Yes, absolutely. That makes lots of sense. Thank you for that. Dr. Vasudevan, I'd like to come to you. It seems like some resistance to public health guidelines comes from misunderstanding the concepts that are involved. And one of those is herd immunity. We hear a lot about herd immunity. Can you tell us briefly how that works and why we need a vaccine in order to get herd immunity without catastrophic loss of life?
Yeah, so if you think about herd immunity, think about a community where nobody is immune to a disease like COVID-19. So COVID-19 can easily spread from one person to another, and that's how community transmission occurs. But let's imagine that you have a situation where 80% of the population is immune by some mechanism, right? So in that case, 4 out of 5 people will not get infected, and therefore not be able to allow the virus to continue transmission. So herd immunity is basically a concept that describes how population level immunity can stop community transmission of disease. Now, there are different ways in which you can develop herd immunity. As we have seen with COVID-19, there have been a lot of discussions about actually getting COVID and using that as a mechanism to develop immunity. The other option is to use vaccines. In my opinion, it's really, a vaccine is the best and safest option for developing an immunity for several reasons. So with COVID, we actually see a wide range of responses that people have. So some people have no symptoms, are completely fine. On the other hand, you have people who are very severely sick, need ICU treatment, and then potentially die from it. So there's like this wide range of symptoms and outcomes that we see with COVID. So with a disease like this, it's very hard to kind of say how somebody will respond to infection. I think the second point that I wanted to make was the data that we are getting right now show that the immunity that people have after getting COVID doesn't last very long. And so from the perspective of herd immunity, you want long-lasting immunity. So the safest way to achieve that is through vaccinations.
Gotcha. Thank you very much. Thanks everyone for posting questions. We've got lots of questions coming in. Please keep them coming and we will do our best to get to all of them. Professor Fitzsimons, I'd like to come back to you. During Tuesday's statewide press conference, apparently Governor Cooper referred to people who refuse to wear a face mask as selfish, which is kind of understandable, but at the same time, I guess can cause some of that reactance you were talking about. So the question is, what effect do you think that approach will have on anyone who is still defying the mandate? And I guess as a follow-up, like what's a different way of phrasing that could maybe get people more on board?
Yeah, just echoing Ben's earlier comments, the way we communicate is going to be really critical here. Obviously, the governor is well-intentioned, but using a term like selfish, I think is going to lead people who are already digging in to dig in even harder. And so, I don't like to describe people that choose not to wear a mask as selfish. I understand psychologically why they're doing it. They're doing it because you're threatening their freedom, or we're threatening their freedom. And so using the term selfish is going to lead them to dig in even harder. And so I think, the language that we use we have to be very careful not to trigger the digging in kind of response. And I used this example many times over the years to illustrate it. But, when my wife wants me to pick up milk, if she says, "Hey, Gavin, can you pick up milk?" it directly threatens my freedom, and I dig in. And if she can switch it and have me feel like I have agency, "Hey, Gavin, did you notice, do we need anything at home?" Oh, we're running low on milk. I'll stop and pick some up. Just that simple little frame changes everything about my mentality about cooperating with a desired behavior, and using negatively valenced terms to describe people who are not following the guidelines. My personal opinion is that is not going to be productive. You can't shame someone who is defending a freedom that they value into not defending that freedom.
Absolutely. Thank you for that. Professor Anderson, I would like to come back to you here. We had a question submitted in advance that talks about the measuring of wearing masks. Apparently, there's a nonprofit headed by the former director of the CDC that issued a report with 15 indicators it recommends states should release to the public. One of them is to do with mask usage, but that's not an easily countable thing. Is there a way of measuring the level of mask wearing in a community, and what would the benefit be from having that number, if it's even possible?
I mean, it is possible. We have other types of ways that we measure adherence to public health recommendations. One that comes to mind that's very common is seatbelt wearing. You know, there's studies, people that go out and do observational studies that count the number of people observed wearing seatbelts. You know, I think a study would be set up the same way, where you'd have samples across the community where you'd be able to get enough sample size to estimate for the overall community what the adherence is. Of course, there's a number of factors that would have to play a role in terms of the types of people and where you go, but I think it's possible. What the benefit of it is I think adherence is important to understand, to look at not only just the adherence itself, but the overlay with that of the actual data for infection and transmission. And I think what it could tell us is, one question is, you know, do we need it's just similar to herd immunity. Do we need 100% of people wearing masks in order to have a significant impact on transmission? Current thinking is no, that's not necessarily the case. And if we're able to have better measurements about the adherence and how that overlays with transmission, that might give us a better sense of what our thresholds are for what adherence should be. And so if we have situations where, you know, people are unable to wear a mask for maybe a medical condition or other reasons, or we have an understanding that, you know, sometimes it's hard for certain people to wear a mask, such as children, maybe it's more difficult for them to keep them on. Maybe we have a little bit more of a cushion, meaning that we don't need 100% compliance, but we would still see a significant benefit of these recommendations even if we had 80 or 85% of people adhering to them. So I think having that data would be helpful in that regard.
Thank you, Professor Anderson. Professor Vasudevan, I'd like to come back to you. You mentioned earlier about the measles outbreak that we've seen in the US as a result of vaccine resistance. I know that another area you've been looking at is a drop-off in regular vaccines because of the pandemic. Sometimes people have been scared to go to the doctor, or clinics have been closed. Are we seeing an increased risk of measles and other diseases for which we have vaccines because of the pandemic, people delaying routine vaccines? And what would your message be about that?
Yeah, I think there's definitely data to show that vaccination rates have dropped since the shutdown began. And as you mentioned, part of it is because clinics were not offering vaccinations. And then in many cases, parents were afraid to take their kids to clinics out of fear of COVID infection. You know, we have not seen many impacts in terms of outbreaks so far because people have mostly been sheltering in place, especially children. There have also been travel restrictions, which means we don't have as many imported cases of infection coming in, which is the primary source of outbreaks, at least here in the US. But I am afraid that as things, you know, open up further, travel restrictions are loosened, children go back to school, we should be definitely concerned about other outbreaks. And what we don't want is a situation where we have, you know, the COVID-19 outbreak continuing, and then other outbreaks happening in parallel. And just one other point with respect to outbreaks is, you know, we're coming up on the flu season. So this is another thing to keep in mind, that we need people to get vaccinated against flu in the fall, because that's another huge impact on our hospital systems in the fall and spring.
Absolutely. Thank you, Professor Vasudevan. Professor Fitzsimons, I'd like to come back to you. There is this politicization question that's already come up here. And one of the questions we've had is that obviously many messages about public health wearing are coming from political leaders. And so some people are shutting it down simply because of the messenger and the voice it's coming from, whether it's the president or somebody on the Democrat side. What can be done about that? Are there ways to turn around that messaging so that people aren't shutting down the message purely because of the messenger?
Yeah, I mean, I'm optimistic. We've seen some movements in the last couple of days across the political spectrum to unify behind a mask face covering strategy. That I hope will take some of the politicization away out of this system. If you compare other countries around the world, I mean, wearing a face covering is not a political issue. It just simply isn't. That's not to say that there aren't people there that would like to not wear a mask, but it didn't get the early political sort of tie-in that we had here in the U.S. The trouble, of course, is that once there was the link between the political and the wearing of a mask, that's where that feeling that the freedom to not wear a mask became really important to a lot of folks. And so the trouble is, once a freedom is perceived to be important to you, it takes quite some time for it to become less important. So I'm optimistic about some recent movement across the political spectrum to unify. I think we have to be patient. It will take some time for the political link to dissipate here in the U.S. and for us hopefully to see the same kind of sort of acceptance of the recommendations that we're seeing in other countries around the world.
Thanks for that. And I think you've kind of alluding to this here. Obviously, earlier this week, President Trump wore a mask for the first time in public, or was pictured wearing a mask and actually advocated mask wearing. Obviously, regardless of where people are on the political spectrum, his behavior hasn't always been consistent and it changes a lot. But do you think that act of wearing a mask could actually nudge his followers to do the same, since clearly there are a lot of people who have been following his advice, as inconsistent as it might be?
Yeah, I do. I think it cannot hurt. It can only help. And as long as now, you highlighted we've been inconsistent, and so as long as there's now a consistent, repeated message, both verbal and physical, right? Wearing an actual mask and letting people see that it's important to wear a mask in public. As long as that's repeated over and over in the coming months, it'll start to shift and move people's opinions. Ben brought up seatbelts. When seatbelt laws were passed in, I guess, the 70s or something like that, early compliance was very low. Nowadays, most people wear seatbelts most of the time. So that freedom to not wear a seatbelt mattered a ton early on. The signaling was consistent, repeated, and eventually the freedom to not wear a seatbelt faded, and it became not an important freedom anymore. And that's the hope, that this freedom to not wear a mask, if you continue to have the repeated messaging across the political spectrum, including from our president, it should start to fade, hopefully faster than seatbelt resistance did.
Sure, absolutely. Thank you. Professor Anderson, I'd like to come back to you, and also our other panelists. I'd be interested to hear if you want to weigh in on this question too. One of the biggest problems with public health messaging around this, and the inconsistency that you mentioned, is that some people still don't seem to be taking the virus seriously, that it is a real threat. What do you think are effective ways for those people that haven't been personally touched, by the virus in their immediate circles, to actually convince people that this thing is for real and needs to be taken seriously?
Yeah, I mean, it's difficult in that if you're just getting information even from a higher level, national, state levels, but you're not personally impacted by it, you don't know anybody who's had it, and you don't feel the effect of the virus, but maybe you're feeling the effect of the economic impact or elsewhere. Obviously, that's going to shift your perception of what the risk is. I think as we look at communication, kind of focusing on that, having communication not only from those higher levels, but also down on the local level, and having people within the communities that individuals trust, that becomes an important component to reaching people who may not, feel the impact right away. So what I mean by that is sometimes even, getting trusted voices within the community of that person that they would trust. So this could be religious institutions, this could be other service organizations that maybe they are a part of. Having that messaging that goes all the way down on a more local and personal level, I think makes it a more impactful message, a more real situation for people, even though they may not know anybody who's affected personally. And I think if we can see more of that on the local level, that probably would be helpful in kind of, again, coalescing people around not only the public health measures, but understanding what the risk is within that community. Again, if it's on a national level, it seems more distant, but if you are focused in on more the local level, what's happening in my community, and we have people who are engaged in that process, I think people listen to that a little bit more.
Greg, could I jump in just to add another sort of layer of this? One way to sort of move the needle is, as Ben just suggested, to try to find trusted voices to persuade people about the obviously the huge impact that the virus can have on a community, on a person. We've actually been taking an indirect route where, rather than try to fight against, people's social media feeds, which are constantly, in some cases, saying, this is a hoax, this isn't real, you don't need to worry about it. Rather than fight that, we've been taking an indirect route, which is to look at the sort of, make an argument to those folks, say, look, I'm not even going to touch whether the virus is real or not. I'm simply going to say that if you want to get back to going to your favorite restaurant or your favorite bar, there's a path forward to that, which is just wear a mask and social distance for a relatively short period of time. And those things that you love will reopen. And so that way you don't have to, I'm not suggesting we replace what Ben just said, but to supplement that approach, the indirect argument of, if you want the things that you care about to reopen, the fastest path forward is to wear a mask and social distance. If we want all our bars and restaurants to be closed for the next year, don't wear a mask, great. And you won't be able to go out to your favorite venues for the indefinite future. And so that, some kind of combination of the direct, tackling it directly through trusted voices in a community, as well as indirectly then arguing, listen, the path forward to get back to the things you love is to comply. Some combo of those two approaches, I think, is going to hopefully get us moving the needle more quickly.
Yeah, Greg, I completely agree with what the other two panelists have said. Even in our research on vaccine communication, we see that there are two important components. One is fact, and the other is trust. So people want facts, but more importantly, they want facts from someone they trust. And a grassroots level initiative, communication campaign would more likely be well received as opposed to a more top-down approach. People don't want to be told what to do, but they want to know what their peers and other community members are doing. So if something is a norm in a community, it's more likely to be accepted. And as Dr. Fitzsimons was saying, it's always good to communicate in terms of benefits rather than threats. So, talking to folks about the benefits of mask wearing, the benefits of vaccinations, I think is a better way to communicate rather than saying, if you don't do something, then these are the consequences.
Thank you, all three of you, for those comprehensive answers. And Professor Vasudevan, I'd like to stay with you. You, as you mentioned, you do a lot of work in vaccine resistance and designing campaigns for vaccines. And I know this is obviously over a long period of time because we don't have a vaccine yet. But what can health systems and public health professionals be doing right now? What should they be focusing on at this point in order to increase receptiveness to the vaccine once it's available?
Yeah, that's a great question, Greg. So there are three things that we try to communicate to individuals in terms of vaccines and other health interventions. So specifically for vaccines, we want people to be confident about vaccines. We want them to know that vaccines are safe and effective. The second thing we want to know, we want to tell people is where they can go to access vaccines. So make sure that vaccines are convenient to access and people know where to access them. And the third thing we talk about is why vaccines are important. So in our current situation where we don't have a vaccine yet, we don't have much information about point number one, which was the safety and efficacy of vaccines. We also don't have much information about point number two, which is, where vaccines are going to be available, how people can access them. So I think what we can focus on right now is really communicating about the importance of vaccination. So telling people why they should be vaccinated. And I said this earlier, vaccines are our best shot of getting out of this COVID-19 pandemic. And there are many people out there, as we've talked about, who are either not convinced that there is a pandemic or don't think that COVID is a threat to them, either because of their age or other circumstance. So I think we really need to start communicating about, why the vaccine is important, why, again, in terms of benefits rather than threats. And we can spend billions of dollars on developing an effective vaccine, but if people don't think it's important, they're not going to accept it. So I think we need to start now. We need to start communicating about the importance.
Absolutely. Thank you. Professor Fitzsimons, I'd like to come back to you. You've already alluded to this, but one of the biggest ways that communication is happening around this virus is online. People having conversations and arguments and fights with each other, people in their circles about what the right thing is to do. You've given us some great suggestions about how businesses can help make people feel empowered in terms of how they come into their business with a mask. Are there any suggestions you could give for people who are debating with family members and friends online, trying to convince them to wear masks, not to come into their business, but just because it's the right thing to do? A way of presenting those arguments, as you said, in a way that empowers the people they're trying to convince to feel like they have a choice rather than they're just being told about something they can or cannot do.
Yeah, I mean, the principles are the same basically, and maybe they're even more important when you're discussing or debating with a loved one. But imagine you have a parent that won't wear a mask and doesn't believe the virus is a threat, or isn't socially distancing when they're outside the house, etc. Again, I hate to harp on it, but the reality is that those freedoms are important to that loved one. And the more you threaten the freedoms, the more that loved one's going to dig in. So you have to try to come at it from an indirect way where you motivate them. Again, well, Dad, they're going to close the pub that you like to go watch the soccer games at, or it's closed now. It's not going to open up for a year unless people wear face coverings and keep a distance from one another. And again, it's sort of, the choice is your loved ones, right? They get to choose when the pub is going to get back open. And if it's their choice and they want that pub to open on a Saturday so they can watch the Premier League, they're much more, I'm using my own dad as an example here, obviously. They're going to be motivated to engage in behaviors that will lead that pub to open up. And arguing about it personally, not being my specific area of expertise in terms of the underlying science of the virus. Even if it was, I don't feel that that many of us can be effective in debating with our loved ones or our social circles about the underlying science of the virus. But you can easily say, well, do you want to watch the Premier League at the pub with your friends? Everybody understands that, and everybody is motivated to get back to those sort of beloved behaviors. And so again, try not to insult, try not to use negative labels with your loved ones, try not to, they have a feeling in their gut that is, people are threatening their freedom to live, their life, and they're going to dig in hard if you threaten it further. So we have to try to find a way to indirectly get folks motivated to engage in desired behaviors without further threatening the freedom. And again, it's even more important with your loved ones, I think.
Sure, absolutely. And I'm relieved to share that while the pubs in the UK are open, my dad has not been back to them yet. So, Professor Anderson, and I'd also, Professor Vasudevan, like to get your perspective on this too. One of the other problems that we've had is that certainly in minority populations, there's been this concern about testing and screening that may not even be safe. And some apparently people have been refusing to get the antibody test. What can be effective ways of convincing people, A, that testing and screening is so very important, and B, that it's safe and doesn't pose any risk to them?
Well, it comes back, to a lot of this is just coming back to communication. But I think for the testing, eliminating all barriers that exist to actually get testing, I think is an important component. I think people have a lot of views on things, but when it becomes inconvenient, it becomes challenging to even get a test. Or if you get a test and it takes 10 days to get a result, that's a lack of confidence in the whole process in itself. And so I think that relates even to people having other views and criticisms to testing itself. Coming back to the communication, testing is safe. There's no concerns about testing in the sense that if it's set up in a way where people can go and get tested without, exposing themselves to others who may have it. It's a really powerful way to give people data about their status and whether or not if they feel like they had a risk of exposure or they're unsure if they are sick or not. I feel like that's a very empowering thing for the community, and it's not only empowering for individuals, it's a very important and critical tool for the public health community in order to implement effective control measures. And I feel like this is one of the biggest struggles that the United States has had in having the resources and implementation of testing in an adequate way consistently throughout this entire pandemic. And so I would say, for the individual concerns, again, it goes back to the messaging and the communication, but I think also there's a larger issue at hand that we need to make sure that testing is available and the barriers to accessing the test are removed, whether that be for resource purposes or locations for people to go in and get testing. We need to make sure that that those barriers no longer are there.
Yeah, the only thing I will add to what Dr. Anderson said was, again, really engaging people at the grassroots level. So we need, community resources, community leaders, peer mentors, social workers, to be spreading the message about testing and screening. I think that's the only way we can communicate effectively in some of these communities.
Gotcha. Thank you very much, both of you, for that. Also, I would remind everybody, we've got some more questions in the Q&A. I'm going to try and get to those, but if anybody has more questions, please do go ahead and submit them. Okay, Professor Vasudevan, we had a question that was kind of a follow-up for something you mentioned earlier. You mentioned about immunity to COVID not lasting very long. What is the current science on that? Have we established that immunity, isn't permanent, or how long it lasts? And where do things stand with that?
Yeah, we are still getting data on it, but I think the most recent estimates from Sweden, where there weren't a lot of lockdown measures, was that only 10% of the population had antibodies. And I think the estimates vary in terms of how long people have antibodies. I think it also depends on the severity of infection a little bit. But all this goes to say that, natural infection is not a way that we can use to build immunity against COVID.
Gotcha. Thank you. Professor Fitzsimons, would like to come back to you. A question that we've had pertaining to some of the stuff you said earlier, you've talked about what businesses can do to encourage people to do the right thing. What kind of a role do you think business leaders have in the potential that they have to cut through political rhetoric as being seen as maybe more independent? There's a lot of research that's come out of Fuqua about CEO activism. But do you think business leaders have a role? Do you think it can make a difference if they are willing to step forward and make these kind of arguments in favor of responsible public health behavior?
Yeah, I mean, I think there's quite a lot that business leaders can do. I mean, one of the advantages of our free enterprise system is that if a business leader decides that they would like to make a change, they don't have to go through legislative action. They don't have to negotiate with all the different parties. They're not subject to lobbying, et cetera. And so if they decide they want to make a change, they just make a change. And it happens instantaneously, and it happens across their entire footprint across the country. Early in the pandemic, for example, just to single out one organization that was quite proactive, Costco implemented a plan where they restricted the number of people coming into the stores. Everyone had to be wearing a mask, both employees and customers. They put plexiglass barriers up to protect their staff. And this all happened essentially overnight. And if you wanted to go to Costco, I happen to be a Costco fan. If I wanted to go to Costco, I had to follow the guidelines. And so I think that business leaders have, I wouldn't say a responsibility, but certainly an opportunity to take aggressive and immediate action in a way that our legislators, just by virtue of government, can't quite move that fast. And so I'm always happy to see our business leaders taking aggressive positions to try to protect their customers and their staff.
Thank you for that. We've also had a kind of almost follow-up question coming from somebody else regarding the business area that I'd like to ask you about. Airports and airlines, obviously, air travel poses a lot of risks, but we've had a question from a reporter who recently returned on an American Airlines flight from Charlotte and said there was little to no distancing in the terminal or in the seating and in the boarding. With specific business sectors like that, what do you think can or should be done to encourage or nudge or force businesses in those areas to be more, take a harder line in the measures that they're taking to protect people?
Of course, we could ask that our government pass legislature that would, for example, mandate middle seats be kept open. That seems sensible in some ways, but my understanding is that the airlines can't break even in those circumstances. So it's this difficult sort of push and pull between what's safe and how those organizations cannot go bankrupt. At the end of the day, I think the most effective means of moving sort of the needle in the business space is consumer demand. If I were unhappy with how that flight went, I'm gonna walk, and I'm gonna use my social media platform to communicate to everyone that I know that I didn't think that airline or that airport had my best interests in mind. Because now we've moved into a world where consumers can talk to consumers directly. They don't have to talk to the airline and hope that they'll have some response. I think there's a real opportunity to push all those businesses to take the actions that we, the consumer, would like them to take. And like any other thing, any other challenge on the business side, the firm that comes up with the best solution that meets the customer's needs better than anyone else can will succeed and be profitable in a way that the other firms won't. And so if I were the reporter that was on that flight, I'd maybe ask about it at a press briefing, write a piece about it, get the word out that you don't think that they handled it well. It'll motivate them and their competitors to do a better job and move us forward in a positive way.
Sure, thank you. Professor Anderson, I'm wondering if you could speak to that. There's been a lot of concern, and we've talked about the confusion and misconceptions. When it comes to air travel, obviously, there's a lot of recycled air on planes and lots of traffic going into and out of airports. Do you see air travel as a particularly dangerous thing as regards the possibility for transmissibility? Or is it just fair to say that there's too much that's unknown about it right now?
Well, I mean, what we do know previous to this pandemic about respiratory virus transmission on airplanes is that it's the risk is somewhat variable. There have been documented cases with some viruses like flu where exposure of a person who's sick and shedding virus on a plane has exposed others and caused them to be infected. And we also have evidence since the pandemic, particularly in China, where flights returning, where individuals who were sick and shedding caused others to also develop symptoms. So I think, there is a risk to it, but I think it's, maybe no different risk than other confined spaces where you have multiple people together. I think in terms of recommendations for that, it's not necessarily eliminating the risk. I think there's always some risk to it, but it's more about risk mitigation. And we're seeing some interesting documented cases. One comes to mind where there was the hairdressers that the CDC reported on that were positive and serviced quite a number of clientele for in the hair salon, but all the individuals wearing masks, and nobody ended up developing an infection. And so I think in terms of even the airlines, if something like having middle seats is unfeasible for an economic reason, are there other ways to structure your guidelines so that every passenger must wear a mask, and that's a rule that you have to adhere to? Maybe that's enough to mitigate the risk, not eliminate it, but mitigate it enough to make air travel, at least for those who need to do it, possible. And again, it comes back to demand or consumer demand and choice. So, consumers don't have to have air travel. Maybe there's other means, but they can dictate some of that through the consumer demand, as was mentioned before by Dr. Fitzsimons. But I think, this needs to go back to having a discussion and work with the airlines or work with any business in a amicable way. Again, not just forcing guidelines on people or businesses, but really working together to say, how do we best implement guidelines that are going to not only keep passengers safe, but keep the workers safe, which may even be more of a concern I would have as a public health official, having risk mitigation for the flight crew. So I think there's ways that we can work together to get the best risk mitigation in place, but it takes a little bit of work to kind of figure out what those options would be.
Sure, absolutely. Thank you both for that. Professor Vasudevan, I'd like to come back to this idea of vaccines. One of the challenges is that it seems like when the vaccine is available, there will certainly be maybe a greater need for adults to get it rather than children. But of course, children have a routine vaccination schedule at the doctor, whereas for an adult to get vaccinated is like an extra step that they're not accustomed to taking. What are health systems going to need to do to get adults to kind of line up for the vaccine? What kind of things need to be done to get it on people's plate?
Yeah, Greg, you're absolutely right that we maybe have better mechanisms for vaccinating our kids and adolescents than our adults. But I will say that we can borrow lessons from the flu vaccine campaign. Flu vaccine is something that all adults are supposed to get as well. So I think we really just need very strong communication campaigns. We need to make the vaccine available at places where people can easily access them. So with flu, for example, the vaccine is available at pharmacies, and a lot of people choose pharmacies as the location where they get their vaccine. So I think that's important. The one other point I wanted to make with respect to vaccines was when we ask in our surveys about, who is it that people trust most to get information about vaccines and to get vaccines from, the most consistent source is doctors. So I think the one thing that we haven't discussed here is the role of medical professionals in communicating about COVID-19 vaccine, and some of these other preventive measures. I think we need to focus on training doctors and residents on vaccine communication, how to provide a strong recommendation for the vaccine. And these are things we are also doing for the flu vaccine. So it's not something new. But I think training medical personnel in this situation is also important from the standpoint that they will be one of the first groups to be vaccinated for the COVID-19 vaccine, just because they're on the front lines. So I think widespread vaccine acceptance in the medical community is an important first step towards public acceptance.
Sure, that makes sense. Thank you very much. And another question that you could address, and I'd like to get Professor Anderson's take on this too before we wrap up. We've had a question that mentions people who are unable to wear a face mask because of a health condition. I think people are curious as to what kind of percentage of the population that truly applies to. And then also what that does for public perception of acceptance of wearing masks when we see somebody that thinks, well, they don't have to wear a mask. And we just assume that that means either we might be angry at them because they're not wearing masks, or we assume that because they are not, that it's perfectly fine for us not to either. Can you speak to the kind of the prevalence of people who actually can't wear masks and what that might be doing for messaging?
Yeah, I'm afraid I don't have that number at my fingertip. But I think the focus should be on, what we as individuals can control. We cannot control what other people do. So I think the focus should really be on, can I wear a mask? I should wear a mask. And, what benefits does that offer to me and my loved ones?
Sure, that makes sense. Professor Anderson, anything you can add to that?
Yeah, I mean, in general, as a public health practitioner, my own personal take is that if you have a condition such that you can't wear a mask, and those are, I think of things like COPD or other respiratory conditions, I personally feel like that puts you in a risk category where maybe you shouldn't be out in public going to places. You should really be minimizing your contact or your exposures completely. But that's a different position. But I definitely want to echo what was just mentioned. I think there is a benefit to the entire community where people are wearing masks. There, that protects the others in the community. But I think we do need to emphasize this point that it's not just that's not the only benefit of mask wearing or adhering to these measures. That there's an individual benefit itself. And I think if people are doing this for their own individual purposes and not really being swayed by what others around them are doing, then that's a benefit, that it helps increase adherence and it makes it a more personal decision. But I also want to echo something that's very important to me that Dr. Fitzsimons has mentioned a couple of times, is I think that not just from the public health community, but also the community as a whole, is that if we can lead with a little bit more empathy and try to come alongside people and meet them where they are, I think that's a message all of us could hear. And I think that would be a benefit too. And so recognizing that there are people that have particular reasons that they're making these decisions, and we can judge them, or we can have the view that perhaps they have a reason that's important to them, and we need to work together to figure out how to come up with the best solutions as a community in order to mitigate this as a whole. And so that would be kind of my biggest personal messaging to others in my family and others in my community, that we need to really kind of take a line of empathy here and try to lead with that and compassion to be able to trust that people are making the best decisions for themselves. And then from the public health side, we can continue to have consistent messaging, communicate from trusted sources. And I think as we continue to do that in the direct and indirect ways that have been mentioned, more of that adherence will come along, and people will have less resistance overall to the measures that are being recommended to them.
Thank you, Professor Anderson. I cannot think of a better place than empathy and compassion to leave it. So I think we will call it there. Thank you, everyone, for joining us. Thank you to our panelists, Lavanya Vasudevan, Gavan Fitzsimons, and Benjamin Anderson, for sharing your perspectives this morning. In next week's briefing, we'll be discussing how to address the misinformation and disinformation that is warping how Americans respond to the pandemic, racial justice, and other issues. If you'd like to be included on that advisory, please email dukenews@duke.edu. In the meantime, thank you to everybody on the call for joining us, and please stay well. Have a great day.